Can everybody hear me? Okay? Okay. So raise your hand if anyone in this room has ever experienced back pain. And what about, have you discovered anything in your history of back pain that something that worked or helped you? Okay. Anybody else? Okay, so medications, activity. Okay. Chiropractic. Okay. Okay, thank you. Does anybody know what the most common source of back pain is? Arthritis is close, but the number one culprit is typically a muscle strain in the big muscles of the lower back. That can be caused from trauma, such as a fall or a motor vehicle accident, but most commonly due to a period of poor postural movements, habits, during your daily activities. Does anyone know what the most common section of the spine is often affected? So it's the lumbar. It's the lumbar region. The four major regions of the spine, you've got your cervical or your neck region. The thoracic region is attached with the ribs at all the sections, so it's designed for structural support and to protect the vital organs, including the lungs and the heart. The lumbar carries most of the weight of the torso, and therefore it's most frequently at risk of injury. And then the sacrum is made up of the back part of the pelvis and connects the spine to the lower half of the body. Ways that the spine can produce pain, we talked about muscular strain, trauma, injury to bones, ligaments, and joints. Sometimes you may have been experiencing back pain, but it's really coming from an organ, such as a gallbladder or a kidney can sometimes present as lower back pain. So just don't assume that it's muscular, especially if it's acute in nature and just shows up all of a sudden. So pain can be acute, which means comes on suddenly and maybe lasts a couple weeks, days to weeks, or chronically as long as 3 months. Therapists are not the only providers that can help you. We usually work in conjunction with your primary care physician, a physician's assistant, nurse practitioner, or specialist, chiropractors, neurologists, and orthopedics. Anybody see something on the screen that relates to them as far as your back pain? These are the common risk factors. Can anybody tell me when you hear core, what that means to you? The core, like core strength? The center, exactly. So it protects the spine, the muscles like the abdominals and the back muscles that act as a corset to protect the spine. When that is weakened, that can cause muscle strain and imbalances. So what I want you to do is think of an activity that typically cause you pain, either bending over to pick something up or going from a chair, standing up. And what I want you to try at home is the next time you do that activity that you know causes pain, is I want you to set your abdominals, like an abdominal brace. We normally do this like, say someone's coming up at you and they're gonna punch you in the gut, you kind of set in preparation. It's kind of similar to that. You're just sucking in your core, and try to do that before doing that painful activity, and that's gonna take the stress off of your lower back. Okay? If that technique works and you have either less pain or no pain with that, that means that you are an excellent candidate for core stability training, a personalized exercise program with a therapist. Okay. Questions so far? Types of degeneration include disc degeneration. As we get older, our discs degenerate. They get smaller, they get flatter, which brings the bones closer together. Often people wonder, the doctor says this is coming from my back, but my back doesn't hurt, my legs hurt. And that's because we have these nerves that come out of the canal. So when the disc gets flatter, the bones become closer together, and then the canals where they come out become smaller. And so that can put pressure on the nerve, which usually presents initially as pain, but with prolonged compression, it can lead to radicular symptoms such as tingling, like pins and needles, numbness, and eventually motor weakness, where that leg might feel like it wants to give way. Has anybody ever had a compression fracture in their spine? Okay. They usually happen in the lumbar, sometimes the lower thoracic area where the vertebral bodies are bigger because, they're more of the load-bearing type structures. If gone untreated, a lot of times with compression fractures, if they're treated acutely, sometimes the doctor will want to do a kyphoplasty or vertebroplasty procedure. Have you ever heard of that, where they put the cement in there to build it back up? Yeah, oftentimes that's effective. There's usually a window of time where it's most effective. But over time, if untreated, it can lead to more instability and pain of a chronic nature. So common treatments of back pain, obviously there's therapy. A lot of you we've seen in the department. We can offer modalities, which are pain management strategies, ultrasound, electrical stimulation, manual therapy or massage, specific tailored therapeutic exercises based on how you present. There's really no generic prescription for exercises. It's really done on an individual basis because everybody presents differently with their symptoms. In addition to posture education, posture retraining, activity modifications during your activities of daily living, environmental changes. If you have a lot of strain working at you work the computer a lot, looking at your setup and see if there's anything that you can modify to make things better on your back. Medications, steroid injections are often very effective. In addition to using assistive devices, if your back hurts when you're walking a long period of time, just holding onto a walker or a cane can reduce that strain. Adaptive equipment, such as, say it hurts when you're standing for a period of time, putting a bath bench or a shower chair in your showers where you can sit and shower can reduce the strain to your back. Okay, name that assistive device. Who can tell me what the one on the left is? Okay, it's a long-handled back sponge that you can use for your back or you can use to get down to your feet. Okay. What's the one on the right? Everybody should know this one. Yeah, the reacher, yeah. And when would a reacher be handy? Well, if your back hurts when you're bending over, you could use it to pick up a newspaper or pick up, small pieces that fall on the floor. If you have back pain with your laundry, getting the clothes out of the washer, which are very heavy, or if you have a top load where you have to reach down in there and it's hurting your back, you can use a reacher to get those things out as well. I'm sorry? Oh, okay. The one on the left. Yep, a raised toilet seat. It just raises your height up so you don't have to strain so much when you're getting up and down, and then the rails where you can have something to push up with versus pushing up on the side of your sink, which I'm sure a lot of you might do. The one on the right, shower chair. They come in all shapes and sizes. They come without backs, just depending on how big your shower is or tub. We can help you decide which ones would best fit. We'd measure and make sure it's the right one before you order one. All right, the one on the left. Shoehorn, yeah, a long-handled shoehorn. again, to prevent where you don't have to reach down for a long, as far as you would with a regular one. And the one on the right? Yep, it's called a sock aid or a sock donner that you can use so you don't have to bend down to put your socks on, or if after surgery and knee or hip surgery and you're limited. All right. So typically the process, if you have an acute episode of pain, of course, you would want to get that checked out with your physician, either your primary or orthopedic. And then if you chose to do some therapy interventions, we would, of course, assess you and what your needs are. We don't generally fork out generalized specific exercise prescription without doing a one-on-one assessment. All right, can I get a volunteer to come up? Anyone? Well, I don't know. Okay, you're going to stand that way first. All right, and I want you to take a look at her posture and tell me if you notice anything about it. I know, right? Yeah. Because typically your plumb line of posture is going to be, you want the ears over your shoulders, over your hips, over your knees, over your ankles. So show me a forward flex posture at the back. You see this like a lot, spinal stenosis, because it hurts when you stand all the way up, right? So we kind of give in and lean forward. And then the forward head, typically seen with people who are on electronics, computers a lot, because typically when we're sitting in the chair and we can't see something, we're going to jut our head forward, right? Because we're not bringing the computer to us. So repetitive over time and over time, that can lead to postural imbalances and pain. And a lot of people wonder, well, I didn't have an acute episode. Why am I hurting? Because typically postural stresses are micro stresses. So doing something so minor for a brief period of time, you're not going to feel anything until you do. Yep. Like a sway back, where some people wear the kind of sacral sit. And that can throw you off backward if you were to lose your balance, because you're not in midline, so it can make you go backward. And the same with the forward flex, you're more likely to go forward.
This the baby.
What do you see?
We see a lot of that here.
Mm-hmm.
You want to get on the stage and everybody can see what you're doing. There you go.
And even, it may be more like this.
Yeah, they're usually not always the same. And we see that a lot with people with arthritic knees or malalignment of knees, because our knees want to go straight. So if your knees are malaligned somewhere, you're going to compensate with your foot so that knee will be going straight. So, and if you use a walker or a cane, that can make you prone to tripping on it.
I can't really demonstrate this very well because my knees are crabby, but the lock knee stand, that's always a bad posture one too. The knees are.
Oh, when they're hyperextended.
Extended knees. We have a few people that do that here.
Mm-hmm.
What's another good one that I'm always talking about this?
Yeah, the forward, yeah. And usually when your shoulders are that forward, you've got pectoral tightness, which is here, that draws you forward. So,
Of course, this is way over.
and this is way over. So trying to find that line from the ear down to your ankle. Using a mirror, can give you some visual feedback on that. Oh, not need.
The weakness in the
Inner thighs. And then another abnormality of walking is when you walk and the pelvis drops. That means you've got weakness in your hips. And over time, when you have an imbalance one place, it's going to work its way up. Has anybody ever sprained or hurt their ankle, and then you're walking funny, and then everything, you start hurting somewhere else? Yeah.
anything else?
No. All right. All right. Give me some questions. Go ahead. Questions? It's your time. Okay.
Well, I have a messed up back. One of the things I show is a cyst, and I've been told gonna push, so you're probably always gonna have some pain.
A disc, you said?
No, a cyst.
A cyst on your spine.
Yeah.
Hmm.
Can you repeat whatever it says so everybody can hear it?
Oh, sure. She was asking about having a cyst in the spine and being told that she's always going to have that and always have pain. I guess it depends on where is the cyst near a nerve ending too? Yeah. So one of those things is just trying to stabilize the spine as much as you can, you know, because we can't fix what's going on right inside there. Sometimes, I don't know if they offer steroid injections for that kind of pain.
I think they said the steroid injections really don't do much for the cyst, but it certainly helped with the discs and
And keeping your core strong and your spinal alignment the best you can, that's going to minimize the strain in that area.
So if one goes to core classes and it hurts, does that mean you need to stop that exercise, or do you work through it, or is that too much of a question for here?
Typically, I would say stop until you can be evaluated, first to make sure you're doing the exercise correctly, and two, to determine the etiology of what's going on with you. Are flexion, bending type exercises better than extension? You know, for instance, if you have spinal stenosis, you're going to have more pain with standing and walking postures because you're standing erect, those canals where the nerves come out get smaller, and so they put pressure. And that's why, you know, usually with spinal stenosis, when you sit, it relieves the pain, right? So that's where flexion exercises are more important. So individual. Next.
I was diagnosed with a pinched nerve in my lower back. What causes that? Do you know?
She's asking what causes a pinched nerve, and typically it could be from trauma, you know, or the degeneration, as we talked about, let me get back to that picture. As the discs get smaller, the places come closer together, and so it protrudes posteriorly toward the nerves, and it puts pressure on it. So there's a bulging disc that only like pushes out a little bit, and then if it's herniated, it actually comes out of the sac and is laying on the nerve. And the one down at the bottom shows how thin that is compared to a normal disc, how thick it is up there.
What is scoliosis? Are you born with it, or can you get it after you get a certain age?
Scoliosis typically presents itself in early adolescence. You know, that's why you have those scoliosis screenings in middle school typically. You can develop it later, especially along with osteoporosis if you have that as well, but it's a lateral curvature of the spine, which can show up as other things. So if you have a scoliotic curve, it can make you look like you have one leg shorter than the other, or it may look like you're kind of leaning one way, but typically it presents earlier, but you can develop it later.
Other than orthotics, what's potential improvement for one leg longer than the other?
There are specific exercises, some muscle energy techniques that we could work on that, in addition to like the shoe lift inserts. Mm-hmm.
I have a question. So is there any one exercise that people that have low back pain, or any set of exercises that's just safe to do at home? Is there any like set of exercises they can do to relieve the back pain, or do they have to come see you and be?
They typically have to be diagnosed because, like I said, if you do a flexion exercise where an extension one is indicated, you can do more harm than good.
But there's no few that just keep a stronger back without, let's say you don't have any back problems.
Mm-hmm.
You want to be, proactive.
Good way to structure that question. Pelvic tilt, like, you know, I talked about the abdominal bracing that you can do in any position. It's like an isometric exercise for the spine. And then like a bridging exercises works the other side, yeah. So bridging and the pelvic tilt, I guess, would be the ones to build upon. Those are the basics.
What can be done to regenerate a disc?
That's a question for your orthopedic doctor. I don't think it can be regenerated.
Or replace?
No. Sometimes they'll go in and remove part of it and shave off some of the bone around it to reduce any compression that's going on in the nerve or on, the disc protruding.
A friend of mine had his neck disc replaced with one from a pig.
From a pig? Okay. I would say that's rare. I've never worked with anyone.
So if I wanted to be evaluated by you,
Mhm.
do I have to go through my family doctor and get a referral?
You can get a referral from your primary care, from an orthopedic,
But I need a referral.
you would need a prescription.
I couldn't just call.
Yes. Yes. And if you need help getting that prescription from your physician, we can help with that. Come on. Another intervention that we do is aquatic therapy. We recommend that for all of our back patients. For those of you that like to get in the water, there's some aquatic program that we can instruct you in if that's something you're interested in. Because some people, they just can't walk too much on land, so they feel like they're getting deconditioned, where you can maybe get in the water and walk and not have that pain.
What questions should we be asking?
Anything that you don't know.
And you say you like to, you like to have good information when you're meeting with someone to provide a program.
Mhm.
So if there are MRIs and if there is an exercise, an X-ray
Mhm.
in the good old Wake Forest portal, is that something, once you have the referral, is that something you use, or do people have to go through all that again?
We cannot access that. If it's done by your doctor, we would ask you to bring in a copy or have him send me a copy of it. Because the better information we have going in, the better prescription we can make.
But it sounds like you wouldn't have to, go through all that again or see the doctor or any of that kind of folderol. You could just ask.
No, if you've already gone prior to coming to me and had all that done, then no. Sometimes your primary doctor might want to try therapy first before sending you to a specialist. So if you come in and we try a few things and you're improving, then we will continue and know that we're doing it, right. If you're not and your symptoms present a different way, then we would refer you to a specialist. I'll give an example. Years ago, I had a gentleman come to me with a complaint of back pain, like lower quadrant back pain. And he came to me and he was jaundiced. He was yellow. So I'm like, I'm not sure if that's going on in your back. So I sent him to the doctor, and it was actually ended up having to have an emergency gallbladder surgery. So, we kind of look at the big picture, not just at the back.
Do you think frequent massage helps?
Massage? Yes. Yes. Anything to keep your muscles limber, because the more flexible you are, the less strain you're going to have on your spine. And we do a lot of manual therapy, and anyone that we think will benefit from prolonged manual therapy, we refer to our massage therapists that are here on campus, so you can maintain your gains. And if you come to us and we don't know the answer, then we will refer you and find someone that does. So.
Now, how many massage therapists do you have on campus?
I believe there's 3 that are working now. Mm-hmm.
There's two.
Oh, just 2?
There's two, yep, uh-huh.
Okay.
Well, we have a gentleman, but not a lot of people have used him.
Okay, so Chilla and Tina?
And then there's a gentleman named Mark, but not a lot of people have used him.
Okay. And they're located right next to Whitney's office, next to the fitness studio.
What was the question there, or what? The massage therapists, who they are and how many do we have?
Anything else? Yes.
So based on what you said, that they could do some things before it was too late. If you have some type of chronic low-level pain, you would go to a doctor.
Yes.
Low level, I mean, typical for aging.
How would you know it was typical for aging? Okay. There's also back braces that we recommend sometimes as we're starting a core program, until those core muscles can get stronger and support your spine like they should. A back brace is often helpful when you have, if you're going to be up on your feet and walking a lot, using that just to hug your back.
Does that prevent you from doing something wrong, or does it really strengthen? What does a back brace do?
It just supports, it gives you some compression to the back to kind of help, promote that abdominal brace.
But you don't want to become dependent on a back brace.
Exactly. It's usually temporary, or if you've got degenerating spinal stenosis and you hurt all the time when you're walking, you can't, walk more than 10 feet without pain, and the back brace can minimize that, then it's something that you could use chronically. Yeah. Exactly. Yeah. And depending on where the level of pain is, sometimes certain back brace might not hit that area. So.
That's different than a posture brace, right?
I'm sorry, what?
Do you have any comment about recliners? I had read that they are not back friendly.
It depends on the alignment. I think it needs to be fitted personally for you and be adjustable. I'm a big fan of the electric ones. The ones that can adjust not just the back and the legs, but you can have a separate adjustment for the back, for the head. Yeah.
Okay, something else with recliners, the ones that are lift chairs, some people think, oh, I need a lift chair, but then you're not using your core muscles to get you up. Some people definitely need a lift chair, but don't depend on it if you really don't need it, because then you don't have any core muscles.
Right, and that's how we instruct people to use it. Get it to the angle where you can get up without as much pain or effort, if you're really straining, where you can get up in one attempt versus having to get up in multiple attempts. And definitely not raising it all the way up, because you do lose it, you're right. Good question. Has anybody ever used a bed rail to help roll over and get in and out of the bed when their back hurts? That's another big one that we recommend for people, especially if they got a high bed, to reduce the strain of getting up, and teaching you techniques on rolling and using the bed rail. And it's just when people think bed rails, they think those long rails that you put on a child's bed, but no, they're small and they fit up at the head of the bed, just enough to give you something to hold to. Yes?
Are there good ways to stretch your back?
Good ways to what?
Good ways to stretch your back, like inversion or gravity boots or something like that?
I've never done inversion, so I'm more of a level plane person with stretches.
How about the rack?
Another thing too, when we do an evaluation, we often like to see you in your home environment to see if there's any environmental modifications and how you do this and that, because sometimes when you come to the clinic, we really don't get that true picture, and we can make recommendations for any, adaptations you might need.
My therapist said that I should roll out of bed rather than getting up.
Mm-hmm. Yeah, like a log roll, mm-hmm. And then push up with your arms, yes. All right, well, thank you everybody for coming. If you have any questions about the handouts, please feel free to call me. We have the same phone number.
Okay, well, let's give her a round of applause. Thank you, Shannon, for being here. We have a gift for you today.
Oh,
thank you for
you.
coming. So the rest of today, the events that we have for Wellness Week is we have a Tai Chi demo. And she's going to show us professional level Tai Chi and then give us a little bit of a lesson. And then at 3 o'clock is the pickleball tournament. If you want to come and watch, we'll have chairs around and some pom-poms. Anyway, come and enjoy. And then I think tomorrow we have the walk. If you haven't signed up for the walk, I think there's still a little bit more room on the bus for that we're walking at the Piedmont Parkway. I think it's about a 3-mile walk. And then I don't have it all memorized. I can't remember it all, but please refer to your flyer and please join us. We've had a great week. And thanks again.
Thank you.